Another horror day in New South Wales, the state recording its highest COVID numbers yet.
172 cases of community transmission.
Up to 111 infectious in the community. The Premier ramming home the same familiar messages.
Time and time again, cases are popping up in workplaces, but also in households. If you have to go outdoors to undertake necessary shopping, please go in and out. Please come forward and get the vaccine.
That vaccine now much easier for anyone to obtain.
Tomorrow, over 18s will be able to access the vaccine in pharmacists. And from Friday, our New South Wales health hubs will be able to take bookings from people over 18 years of age for the AstraZeneca vaccine.
The state has also amped up the number of pharmacists offering the vaccine in West and Southwest Sydney as the virus tears across suburbs.
We're now seeing the virus become more prominent in Western Sydney than Southwestern Sydney. Of course, we want to ask the Southwestern community to stay vigilant.
Today, Victoria's Premier slammed New South Wales for its decision to not bring in a ring of steel around Sydney.
There's a refusal to lock people in Sydney into Sydney, so therefore I have no choice but to make these changes. They'll be locked out of our state for as long as they have that view, or until they get their cases down.
Dan Andrews removing 4 New South Wales border communities from the Victorian bubble in a desperate bid to stop further incursions.
I would respectfully say to the New South Wales government, you're not just making decisions for New South Wales, you're making decisions for the whole country.
We have our own course here in New South Wales, and the New South Wales government continues to take the best health advice on the way forward.
It comes as Victoria today ends its 12-day lockdown.
5 kilometre limit, that's gone. 5 reasons that no longer applies. Schools will open, pubs, restaurants, cafes, bars, they will open.
But with 10 new cases, all in isolation, authorities are proceeding with caution.
No visitors allowed to your home. Masks will remain inside and outside. No crowds at large events for at least 2 weeks.
And a degree of triumph.
We have seen off 2 Delta outbreaks. I don't think there's a jurisdiction in the world that has been able to achieve that, and every Victorian should be proud of that.
Jane Halton is the chair of the Coalition for Epidemic Preparedness and Innovations, and she joins us now. Jane, let's start with Daniel Andrews, Victorian Premier, because in that package we saw some really quite harsh words for Gladys Berejiklian today, specifically over her refusal to implement this ring of steel around Sydney. Is he actually right about that?
Well, I'm not quite sure exactly what a ring of steel looks like. I'd actually personally prefer a ring of vaccine, to be honest with you. But look, he's done a great job in actually beating back what's happened in Victoria, and I think we should congratulate him for it. But I do think we need to now focus on how the New South Wales outbreak is going to be brought under control. So, yeah, tough words, but I understand why he doesn't want any more cases coming across the border and putting back to point zero, I suppose, what they've already achieved in Victoria.
What about the idea going around of parts of Sydney that aren't experiencing as bad COVID be released from the restrictions, and those that have many, many cases stay locked down? I mean, is that a good idea? No. Put very simply, look, we saw, and again, let's look at the experience that poor old Victorians had last year. We tried this sort of suburb by suburb approach, and we know that it didn't necessarily work. We also know that at the moment in Sydney, you can move around up to 10 kilometres to go and do things like exercise. So I really do not think it's necessarily the right thing to do to start taking lots of restrictions off in some areas. Sydney's one big town, with possibly the exception of that little peninsula to the north, and the truth is it's going to be potentially all over Sydney. So, no, we shouldn't be letting those rules off anywhere in Sydney anytime soon. So what rules would you be adding? What would you be doing now other than obviously getting vaccination rates up? Look, I do think it's time to start thinking about whether actually you really do need to move that 10 kilometres for exercise. I'm not sure why you can't just go and exercise somewhere much closer to home. I do think this question about when you have to wear your mask, I am personally very discomforted by seeing lots of people in public places without wearing masks. I do think we need to be much firmer on those rules about visiting households. People have been told you cannot go to see other people in other households. I know that's tough on people, particularly if it's family members, but we actually have to make sure that these rules get applied and get applied very firmly. These cases are transmitting in younger people, 20 to 40-year-olds. They're also the kinds of challenges we've got in terms of their employment. So let's think about how we protect all of those people and actually make sure this thing stops.
So, Jane, the big question, given today's numbers, realistically, how long is Sydney's lockdown likely to be?
Well, it's going to be going for quite some time. I think we can all see that unless everyone gets behind the program and does what they've been asked to do. So it's not going to be done in 4 weeks. I really suspect we're going to be seeing this into September, and that is going to be hard on people. But the fastest way to stop this is if you can get an appointment, go to see your pharmacist to get vaccinated, and then do the right thing, everybody.
I think everyone, including you, hopes you're wrong about that, Jane, but I fear you might not be. We appreciate your time.
I agree.
With so much content online, it's sometimes hard to keep up with it all. And let's face it, who has the time? The Project YouTube has you covered with the stories that matter. Hit subscribe for a daily list of the news that you need to know.